This video is going to demonstrate the elbow exam. So let's get to it. Rob, can I see your elbow here? So I'm going to start by palpating different areas that are common areas of pathology for the elbow. So if you follow my thumb, right here, I'm on the lateral epicondyle or the common extensor tendon. Mm-hmm. Is it tender there? Mm-hmm. Okay. Do you have symptoms there? All right. So he is 2+ tender at the left lateral epicondyle. So we have the lateral epicondyle. Now we're going to go in here and we have the medial epicondyle. We'll demonstrate the common flexor tendon on the right. Tender in here? No. Okay. Great. Then I'm also going to test to see if he's tender in the back here. This is the olecranon process. No olecranon tenderness. And we can test through here. Any tenderness through there? Great. So we palpated the epicondyles. Now we're going to do some specific tests to provoke the pain at the epicondyles if the patient has it. So Rob, can you extend your wrist like that? Great. I'm going to push down. Resist me. Any pain there? Okay. So what he's doing here is extending the wrist, which puts tension on the lateral epicondyle, and he's resisting me without pain. So that test is called Cosen's, and that's negative. Now we're going to have him flex his wrist. Yep. Resist me. Any pain? So that is testing. We can demonstrate that on this side. Sorry. Resist me here. Great. So flexing the wrist and resisting it, we're putting pressure here on the medial epicondyle. That's called Mills, or simply resisted wrist flexion. That's negative for him. Next, we'll test for stability of the elbow. So this is going to be common for elbows, wrists, knees, ankles. Most commonly, it'll be done at the elbow and the knee, and it's called valgus and varus stressing. Both the elbow and the knee, they have collateral ligaments on the sides that can be commonly injured, and if they are either weak or torn, they're going to have more mobility when they're stressed in that way. So here, when I'm applying pressure from medial to lateral, this is called Varus stressing. So I'm just going to push straight through the joint and test his stability. And it's not moving much, so that's stable. So he's stable to Varus stressing. And I'm going to demonstrate valgus on this side, where I'm pushing from lateral to medial. Again, this is valgus. So I'm pushing through here. He's got a little bit, but that's normal. It's nothing too abnormal there. So normal valgus stressing. Another issue that can present in the elbow are nerve issues. And there's three main nerves that run through the elbow, but most commonly only 2 of them would be pathologic. So I'll demonstrate those 2. So one of them would be the radial nerve. The radial nerve will come in through here, and sometimes they'll complain of numbness, tingling in the forearm. So what we'll do is a test called Tinel's. And Tinel's is basically tapping. What's important about Tinel's, you'll see this in other areas that we examine, is to locate where we're tapping. So if we're tapping here and we're asking him, does this reproduce any of your symptoms? Nope. Okay. And we tap a good, technically you're supposed to tap for about 30 seconds. We don't always do that, but that's all right. So we're tapping there, it doesn't reproduce his symptoms, but we're at the radial tunnel. So in your chart you do Tinel's negative or Tinel's negative at the radial tunnel. Next, we're going to demonstrate the ulnar nerve. The ulnar nerve runs back through here, and this is called the cubital fossa. So I'm going to tap through here. He might get a little, this is kind of similar, people might feel what they feel when they hit their funny bone. So you might feel a little bit, but nothing like that's lighting you up. Yeah. So, and he's not complaining of nerve pain through there. So I would say Tinel's negative at the cubital tunnel or Tinel's negative at the ulnar nerve. Another thing to assess for medial elbow pain would be for ulnar nerve subluxation. So the ulnar nerve, as it goes through the groove here, it may or may not sublux over the medial epicondyle. So patients will often complain of snapping that they feel at their elbow. So what we can do is assess for that just by flexing and extending this. So right now, I'm assessing for ulnar nerve subluxation. If it doesn't sublux, then please chart it as no subluxation of the ulnar nerve on dynamic stressing. We'll also examine that. If we think that it is the problem, we'll examine that on ultrasound, and we can see the nerve in real time flip over the epicondyle. So the elbow exam is pretty straightforward, and we're done with that one.